Zika, still a major concern here in the U.S., especially as we head into the summer travel season. Martin County now has 1 case, Palm Beach County 7 cases, and there has been 1 death already across the nation. Here to help us understand the concern about the spread of the virus is News Channel 5 medical expert Dr. David Soria, director of Wellington Regional Medical Center. Doctor, good to see you as always.
How are you?
I'm doing well, thank you. You know, we've spoken several times before about Zika. It's like many other mosquito-borne illnesses that we've seen before. How worried should we be, though, as the numbers continue to climb and now 1 death reported?
Yeah, you know, it's interesting because early on, really our concern was only with pregnant women.
Right.
And, you know, just like any other mosquito-borne illness, starts off with some joint pain, maybe a low-grade fever, some headaches, myalgias, and then typically it resolves on its own. And now that we have attached, or at least we have some data that shows that there is more dangers in addition to just pregnant women, I think the concern is still out there. Now, the good news is that the exposure here in the States has still been relatively low. Typically, you know, at this stage in a mosquito-borne illness or any viral epidemic, we've seen numbers much greater than about 400 to 500 that we've seen nationally. But Florida is a major state in regards to where these exposures are happening. We've seen over 100 already,
right.
40 of which is in Miami-Dade, which makes a lot of sense because obviously it being a major port, and you bet, and all the travel.
Exactly, yeah.
But 7 here in Palm Beach County. And that 1 death reported in Puerto Rico, I think really has shed a lot more light on the dangers because it was an elderly man, 70 years old, so a man, not a pregnant woman, and he died of what we feel or believe is a platelet disorder that could have been triggered by the Zika virus that caused an uncontrolled bleeding problem for him. And so does that mean that we're going to see more of these? We don't know. But I think that our level of vigilance in regards to where we go, where we travel, and certainly preventing mosquito bites and putting ourselves in danger or at least in exposure to mosquitoes, I think we want to minimize that. Not if you're female, not if you plan on getting pregnant, but all of us. We don't want to really bring it back to the States and create any more of a problem than we've already seen.
Quickly, because we've got to go. The Olympics happens this summer. How do you see that affecting the attendance?
Well, I think there's going to be a lot of fear. I think there is, and I think there's probably going to be people that were planning on going that won't. I think Brazil will probably do the best they possibly can to put precautions in place, and I think anybody that travels there needs to watch the CDC guidelines, listen to them, talk to your experts, talk to your doctors, and do the best you can, obviously, prevent and minimize any exposure.
As always, thank you for your expertise.